So, welcome everyone. Welcome to September Tableau user group. Thanks for coming. So originally I didn't think we'd do virtual. I thought we just switch to in-person only, but two of our presenters are sick and can't come. So I think that's good to have the virtual option still. Hang on, I'm just removing those things. So yeah, thanks for coming. I think it's always good to have people coming in person or virtually. The tag user group is not without anyone, so I'm always in a hand for presenters. So if you're keen to present, if you got a topic to talk at the next one, for example, we're always keen to hear good stories. So find us on LinkedIn. There's a page on LinkedIn, or just talk to me or Carl. Again, thanks for the KeyData team to host us. With some amazing food and organize the event with myself. That's always good to get Tableau groups together. I also like to acknowledge the traditionals of the land. So we spend today. I think that's important to acknowledge that. I'd like to pay my respect to past players and elders in the room. And just in case if you don't know more, I like to remind us we're on the Ugara and Tableau country. So it's always important to know where we are, which land we sitting on. Today we got a couple of presenters, or three presenters. Manuel, is at the back. And Dave talking to us about Tableau and Salesforce integration, which I think is a cool topic. And I'm also very keen and excited to hear from Lyle, who was supposed to come and is fallen sick. So thanks, Lyle, for coming on the Zoom, which I think is amazing. So Lyle works at the Institute of Urban Indigenous Health. So he's going to talk to us about Indigenous health data. So I think that's a very good topic. So first up, we've got, I think, Dave, you wanted to do some intros?
Yeah.
Yeah? Yeah. So you need to talk loud, Dave, because you're on the small speaker.
Okay, thanks, Fred. Thanks, Fred. Hi, everyone. Really, to be honest, this is going to be the Manny Tirado show. Manny joined us about a year ago. He's got a great understanding of Salesforce, no understanding of Tableau till recently, very recently. So this is really just where Manny's been putting some effort into trying to use Tableau with Salesforce and showing some of the integration capabilities we've got with it. As you know, Tableau great for narrowing down what you want to focus on, but then we've also been working with it to build in some integration so that can just take us where we need to be in the entire process flow. So with that, I'm just going to hand over to Manny. I'm away today. I've got a little thing where I'm working from home for a week. So Manny, over to you. Thank you.
Just get the logistic going. Can you present this?
Yeah,
cool.
All right. Hello, everyone. So, as Dave mentioned, I joined KeyData a while ago. I come from a Salesforce background. I've been using and working with Salesforce for the past 7 years, and I've recently come to start using Tableau. So, Tableau got acquired by Salesforce in August 2019, and since then, a lot of new, very awesome possibilities started to open up. I'm a very, very young Tableau user, but I've managed to do some stuff that can actually spark curiosity and potential solutions, depending on the stage of your business journey. So leveraging the power of Salesforce and Tableau is a very popular topic, like throughout the web and everywhere, really. And the functionalities they both have are quite remarkable. Nevertheless, organizations are unique and their journey is very different. Like everyone just has a specific way of dealing with the challenges and gaps each of their organizations have. So, trying to see, businesses, what they actually demand is velocity. And by demanding velocity, they demand insights that are certain, clear, and relevant, so that everybody can take action. So a couple of these challenges that businesses have, and we have to understand and have clarity of why we're doing this integration, what challenges are we going to be addressing, is first of all, the quality of the data. So in a lot of businesses, in a lot of platforms that we use, data hasn't really been cleaned. Then the data dictionaries are not known throughout the organization. Different areas use different technologies. And of course, the reference fields in way that you use to connect different tables are not clear. Then the second front is performance and collaboration. Sometimes in some kind of businesses, the stakeholders can be very protective of their data and how they share the information and insights and processes with other people in the organization or potentially outside the organization, depending on the business model. And sometimes it's unassessed, like the performance metrics that you want to show. A lot of business areas, depending on the team and capabilities that they have, they can actually produce a huge amount of KPIs that do not really serve the business purpose or do not have connection with all the business areas. Then the third front is the standardization of visuals. Different filtering approaches are used throughout organizations. So that means that people can use funnels in marketing, but then they don't use funnels. They use something else in accounting, and they use something else in another area. And then when they try to present to corporate, then it's just, they have to explain several times, oh, this is for this and this is for that. So that lack of dictionary translates in lack of visual standards. And of course, the challenge that now you have is that you have visual tools and you have platforms that are as powerful as Salesforce. If some people don't know Salesforce that much, what it is a suite of different clouds that can serve purposes from field service cloud, which is what you use to create cases, for example, in industries like mining or shipping for ports, logistics, and you can create cases on the spot. You have Sales Cloud, which is a different cloud that is for managing the funnel and the pipeline that you guys have. And there are different clouds: Finance Cloud, Human Resources Cloud, multi. So those are usually the challenges. And for the business development, it's relevant to understand the challenges the business has. At the end of the day, you are going to address these challenges because you want to understand the business users, identify information you need to drive your business, design meaningful visual analysis to support the business model, and consider potential training that you need to provide to your own users and to the stakeholders of the business. So the integration advantages of Salesforce and Tableau provide you with a suite of different happy fronts. First of all, you have a single work front. Working in Tableau is extremely simple. You just drag, drop, you create calculated fields, you start connecting your data sources. You can combine data sources from different fronts. And especially you can connect from Salesforce. So you can connect to Salesforce. So because now Tableau is part of the Salesforce ecosystem, you can log in to Salesforce from Tableau and grab all the data and use Salesforce as your data model. And then just bring external data sources. You can use SAP, Xero, Oracle, whatever data source you want. You just bring it in, use a Salesforce model, and you have a standardized way to use dictionaries of the data from different fronts. Security. I know that in Tableau, you use Tableau Server to just model the permissions and to just set who needs to see what's in which front. But then Salesforce manages hierarchies and profiles. So even if you don't assign any sort of permission, you can just embed the platform Tableau into Salesforce, and it will inherit the hierarchies and profiles that Salesforce is using. There is not really right way to do these, like other way. You can model the hierarchies and the permissions in Tableau and then put that straight into Salesforce or vice versa. But having that ability to just use Salesforce in that way and inherits the permissions is fantastic. And obviously improve the user experience, because even though I love Salesforce, I know that there are some things that still need to be worked on. Some fronts that Tableau has very well figured out. And that is the interaction that you have with dashboards. The interaction that you have with the dashboards and the ability to filter stuff the way that you want and how you want it. And the predictive analytics that you can get out of it is just unreal. So I think that those are the integration advantages. So how it works is going to be pretty much straightforward. You connect Salesforce to Tableau desktop, and you can extract the information, or you can actually connect it live. Connect external data sources to Tableau desktop and map the fields and keys that you need. Then you publish that to Tableau Online or Tableau Server, and then you embed using the Tableau Lightning connector. So this is a very simple way to do it. You just go to Salesforce has this like an app store, and within the app store there's components. They have one thing that's called the Tableau Lightning components, which basically you just sign into your Tableau once, and you can do SSO as well. But once you have that sorted, you just drag, drop, and paste a link of your Tableau dashboard, and it's embedded. So now I would like to share my screen because
demo, live demo.
Yeah, I will show like what it looks like.
It's dangerous.
So how
I'm
do
trying to
I?
understand more about the licensing, work. If you got Tableau creators license on the server, are those licensing?
Oh, I have embedded it into Salesforce.
So they're embedded into Salesforce.
Yes. So I'm going to show two different approaches of how Tableau looks in Salesforce. The first one is going to be how you bring data that is out from outside Salesforce into Salesforce and have a dashboard, a Tableau dashboard next to a Salesforce dashboard. And the second version is how you actually combine the whole thing, like Salesforce data and financial data from external data sources. And you can, without leaving the actual dashboard, you can create tasks in Salesforce. So you can trigger actions and start triggering actions. And I mean, the dashboards compared to what my colleagues can do in Tableau, it's not that pretty. I'll give it 9 out of 10 compared to what they can do. But I think it's a working process. So
It's a bit of a healthy competition there.
yes.
Tableau and Salesforce.
So I don't know how I can share my screen yet because you're sharing. You think you can help me to
You are
stop the presentation?
That's why you cannot share the screen.
How do you remove the control?
If I stop share,
Yes,
But-
share.
that means
Many are you sharing from a different laptop than Fred's?
Yes. So
Yeah, so we've got to stop sharing on Fred's and then share from yours.
yeah, I will share from mine.
oh shit, there's a lot of people online.
Screen.
Hi everyone.
Hey, all.
Hey John, how are you?
That's got it.
Now we can see your screen.
All right.
Can you guys see the screen?
Yes, we can see it.
It's really pretty. Yeah, that's it.
Awesome.
I'm not touching anything.
So what you're seeing here is a home page of Salesforce. This is being done in an environment, a control environment called Sandbox in Salesforce. So all this data is mockup data that I randomly generated. So it doesn't really make sense if you read it because there's a lot of medical terminology and data terminology, given that it's mockup data. But then again, I'm going to try to explain a little bit. There are services, there are industries, and of course, this is all data that a sales rep can see in their own Salesforce, which is a CRM, customer relationship management system. And then you have external data that maybe accounting has, or that is embedded in Oracle or in Xero. So I created this app called, I call it demo app embedding. And here you can see, second, hopefully I can put this here, yeah. Here what I can see is objects. So this is an object, the top left is called opportunities. This is another Salesforce object called open tasks. And this is a Salesforce dashboard. So, and at the right-hand side is the embedded Tableau dashboard. So in the left-hand side, that the Salesforce dashboard has some very cool visuals, but some limitations. Some of these limitations are, for example, we are limited to only 3 filters. You can only have 3 filters in a Salesforce dashboard in Sales Cloud. And then you only have very limited amount of visualizations that you can pick from. Another thing is that if you want to select and create filters, you have to manually create them. So one by one, you have to start inputting like what you need to put in the filter.
Can you press F11, please? Devon is asking for friend. F11 on the browser to make it bigger.
Oh, like this.
Full screen.
Is that better?
Yeah.
Okay, great. Thanks. So if I click on this, it's actually going to take me to a report, because every single Salesforce dashboard is created from a report. It is different in Tableau that you just grab the tables from your data model and you just drag and drop, and everything's going to be there depending on the filtering that you apply. So sorry, Devon, I'm going to exit this for a second so that people can see what this is all about. If I click this, it's going to open a report. And then that is not how people that are used to working with Tableau is. I'm coming from a Salesforce background, just having the ability to click and see and make the dashboard adapt to whatever I want to see is incredible. So that's a great functionality from my point of view. So if you want to find something here, because this data is not from Tableau, these are different objects, different data sources at this stage. You have to go and click something here, and then you have to go and click something here, and then it filters, but then there is not clear relationship when you're trying to follow up on something. Like you have to filter twice. You have to start checking on things twice, which is kind of a bit of a struggle. But then again, some businesses are in that stage in their journey in which they cannot combine different data sources yet. So it's an alternative as being part of the journey where they are at. And then in the second one, the second application that I developed, I actually combine the data sources. And in this one, you have all the financial information in the top, and then whatever is related to the opportunities and the pipeline that the business has in the bottom. So a couple of questions that I was like trying to come up when I was doing this is something like, all right, so what is the product that I sell the most? And then what do I have in my pipeline to make the business keep growing? So having the ability to just filter everything out, or just grabbing, payment status, late, and you can just see whatever you have in late payments. So you know that doctor session is the one that suffers the most in Philippines in transport. And then you go like, all right, cool. So I just want to check what I have in my pipeline. And what I have in my pipeline is I have health check very way at the top. And doctor session is up here. So it shouldn't be a concern, but it would be great if I can just go and tap doctor session. Doctor session here. Just to check who has that, because it has obviously some late payment issues. And just I can create from here. I go like, all right, so who has this? Charles Robertson and Daniel Chambers and all these people. So I can go ahead. It's like, all right, cool. I can go Charles Robertson and Daniel Chambers, and it's like payments. Just be aware like these days. So, hey guys, be aware. Blah 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 blah. And we a high priority, and you say
get paid money.
they were
Bit more.
payments for and you just let them know, like, be aware you have this in your pipeline. This is what's happening.
So you think you can do a search a cross search between Salesforce and Tableau data, or you have to blend the data together?
Now it's blended here.
Yeah.
So I can, like in the bottom of the page, we have everything that is Salesforce,
And the top is
and
Tableau.
the top is data that is from finance.
Uh-huh.
So payment statuses and accounting, and all of this is blended into one dashboard that combines both bits of that.
So you showed on the previous tab a report. You said in Salesforce it's a report, and then you build your dashboard on top of the report in Salesforce with that mentioned, right?
That is the way to do it.
And then this is different.
Yes,
So
because
just explain the difference between what we saw before and how this data comes out of Salesforce.
Sure. So what you do you can model your data in Tableau from finance, and you can create your own dashboard that just reflects finance. And then if you would like to provide some feedback or guidelines to the sales team so that they can stop selling services in specific countries that are commonly late, then what you do is you bring that information into Salesforce and you start developing insights with the sales reps. If you do not join this data together, having a Salesforce dashboard that comes from a report and a Tableau dashboard that comes from a table, a set of tables or another platform, is going to be a lengthy process because you will have to find in one side and then look in the other. This is not wrong, but it's just part of the process of adapting yourself to working with different fronts of data. Then the second one is the output of combining all data, financial data and Salesforce data into Tableau desktop, making that migration to public or and then having that embedded into Salesforce with the Lightning Connect. So it's two different approaches. One simplifies the other a little bit more, but this is what I've realized could be very useful for the collaboration and interaction teams. We're not touching upon the business process, how the teams work, the leadership strategy. We're just talking about what information is relevant for me to know from this area that can highly impact my goals and the functioning of my area. It's a friendly way of putting it. Again, that is what I have. I wanted to share with you guys. So,
Manny, just before you finish up, one last thing you could do, if you go down to one of the opportunities there, you can use those upper charts to focus in on different opportunities. But from these, because this data is being sourced directly from Salesforce, it gives us the capability to link it directly back to the relevant record that we might be looking at, whether it's a opportunity or lead or client or whatever the case may be as well.
that's correct.
So it simplifies the navigation quite significantly.
Can you hear me?
So
to repeat a couple of points.
what it does is basically Salesforce has the ability to create hyperlinks to the actual opportunity that you have. So if you're looking at Tableau dashboard embedded in Salesforce, you can just go ahead, create a hyperlink. I name these go-to opportunity, and once you click it, it actually takes you to the opportunity in Salesforce. So you can see who's the contact, what product are you selling, how much is it going for, when did it close, and all information that is already in Salesforce, as well as any other information relevant like the stages and comments and emails. In this case, we do not have any emails here, but Salesforce does connect to Outlook or Gmail or whatever email source you have, and you can have traceability of all the interactions, quotes, products, agreements, approvals that you have. That's part of Salesforce itself. So I guess that combining these two very powerful platforms, it's something strategic that any organization that has them or wants to have them could potentially use.
I like how it's in the one tab as well. So when you clicked on the show me the opportunity, it didn't open up another tab. Right now, sometimes we frequently end up with 12 tabs open.
Yeah,
it was nice and in the same view.
well, you can actually edit that. So if you want another tab, you can actually do that as well. Yeah.
When you're in Salesforce, you can create reports which are very basic. The Salesforce dashboards are pretty basic.
So
They're not as good as Tableau. You even said that.
no.
Can there be a one day where all the Salesforce graphs would be done by Tableau natively, and then
Well, since acquisition in 2019, Salesforce dashboards have evolved progressively. There is some things that Salesforce dashboards and reports are still not doing, like regression analysis or multivariate regression, or those kinds of really predictive analytics that Tableau can do. I think that in the short, maybe in the medium term, Salesforce is going to start adapting and acquiring a lot of Tableau's functionalities. But still, even then, I think that Tableau is a tool that is very strong, and won't be that progression won't be that quick.
Takes time.
Yeah,
And another one, with the Lightning connector, does that mean you don't have to set up your relationships in Tableau for your Salesforce data?
no, actually, what you do in Salesforce is you can go two ways around. You can, first of all, you can embed Salesforce into Tableau, or you can embed Tableau into Salesforce.
Yeah.
Then, if you want to connect to Salesforce, what you do is when you add a new data source, you have the option to say Salesforce.
Yeah.
And then you just enter your credential, and the data source appears with all the tables already ordered for you, with all your custom objects and custom fields. Everything is there.
Yeah.
So you can just use that as your data
You
initial
still have to
data.
set up the relationships, right?
Yeah. Thank you.
Measurements.
Any question from the Zoomers? People online? Thanks, Manny. That was cool. Nice talking.
Thank you.
Oh, no questions? So we're going to move on to Lyle. You still there, Lyle? Lyle Turner?
Hi, how are you?
Hello. So Lyle was meant to come today and he's sick. So big clap for him. He's sick and struggling from home. So thanks again, Lyle. So I'll
That's all right.
ask you to share your screen. I think it worked before. So, and then I'll let you talk about Indigenous Hub.
Yeah. Okay. So I will share, and then I'll probably just turn my video off.
Now we see.
Just to provide a bit of bandwidth opportunity. So hi everyone. So yeah, my name's Lyle. Firstly, I'd just like to acknowledge the traditional owners of the land also on which we're meeting today, and pay my respects to elders past, present, and emerging. So as a sort of, we've been a Tableau customer through KeyData for a little while now, nearly probably 2 years. So yeah, just was given the opportunity to come and provide a bit of insight into the Institute, what we do, and sort of our data story and how it's led to us sort of utilizing Tableau. So I'll just stop and share. Right. Okay. So yeah. Sorry, I'm just going to minimize a few things. So yeah, the Institute was established quite a while ago, back in 2009. At that point, we had 4 Aboriginal community controlled health services operating in Southeast Queensland. So these are sort of individual standalone organizations. And it was sort of recognized by the boards and CEOs of the 4 organizations that it wasn't, that they weren't working in a very productive way. So they were competing for government funding against each other. Patients obviously living in the one area could have been visiting multiple organizations, and so data wasn't being shared, or the information around their care wasn't being shared, which was important. And so the decision was taken to develop this sort of regional body where the 4 member services, so that's Brisbane ACHS, Brisbane Aboriginal Community Controlled Health Service, Cowan Health Service, Cambu, and Uluru Biriba, came together to form the Institute. And basically the initial aim for the Institute was to integrate, as I said, the planning, development and delivery of comprehensive primary care across the Aboriginal and Torres Strait Islander population in southeast Queensland. So we had Brisbane, which sort of covers, I mean, their original clinic was opened up in Woolloongabba, and they cover a lot of the South Brisbane, heading down into Logan, Waterford, all those sort of areas. Cowan covers the Gold Coast all the way up through to Coomera, and down to Balinga, just on the border with New South Wales near the airport there. Canberra covers all out west, so we're talking Ipswich, Goodna Vale, right out to Laidley, which is their furthest clinic, and Uluru, which covers the Redlands area, so Capalaba, Wynnum, and Stradbroke Island as well. And so those four came together. I've mentioned Morton Essex there, so that's a new community-controlled health service that sort of sprouted from IUE. It's actually a subsidiary of IUE now. Initially, it was intended to sort of be a standalone or sit under Brisbane, but it's just sort of sat with IUE since the beginning, and that seems to have worked best, and that's where it stayed. So what does the Institute do? Well, our mission is family health wellbeing through integrated health and social support services. So it works to integrate basically a fragmented health system with lots of contact points, difficult to navigate, particularly for vulnerable populations. And so to integrate those together, bring them together from a patient perspective, and also the sector traditionally has had to rely on sort of grant funding. So you're having to cobble together funding from a lot of different sources, which becomes quite inefficient. So IUE was kind of created to generate, I guess, an economy of scale, if you will, in the sector, and and support, I guess, more optimal kind of packaging and usage of funds to get maximum bang for your buck, I guess, in terms of service delivery. And also in line with that as well, providing a regionally consistent and standardized model of care that's rolled out across the network. So instead of having 4 different organizations, each operating their own types of models, kind of introducing an evidence-based standard model of care that's rolled out through all clinics, so every patient's receiving the same evidence-based care pathway, I guess you could say. And and we talk about integration across the entire patient journey, so from initial contact or from birth right through to old age. So we provide services to around 43,000 clients in Southeast Queensland. That's regular clients. So we class regular as someone that's had 3 contacts or occasions of service with one of our clinics in the last 2 years. And it usually sits at around 85% Aboriginal Torres Strait Islander, 15% non-Indigenous. So the non-Indigenous are generally family members of someone that's of Aboriginal and Torres Strait Islander descent. And so when I talk about integration, so there's several levels we're talking at integration. So as I said, it's a regional health system. So IUE is responsible for planning and service development. And a big part and backbone and where Montague comes in is the information systems and the data that comes out of those. But IUE has also been responsible for introducing, as I said, clinical governance standardized around the region. CQI is continuous quality improvement, which is a process of quality improvement throughout all clinics. And that goes across multiple facets of service delivery, data quality, a lot of areas that are touched on in the CQI space. IU is also responsible for workforce development, so student placements, GP registrars, and a population health level out in the community, so Deadly Choices and more recently MobLink. So, and the initial focus of IUE was supposed to be that sort of regionally coordinating body that was responsible for planning, service developments and new service development, but it's kind of worked out, I guess, that IUE takes a big stake in the actual delivery of care as well. So I mentioned we've got MAT6, so that's the network of clinics up on the north side, but we also feed into the model of care that runs throughout all the clinics. So we provide all the wraparound services that clients receive in addition to their primary care they get from the clinics. So it's intended, I guess you could say, that a clinic's sort of the one-stop shop, whereas if you're in mainstream general practice, you'll get a referral off to an allied health specialist or social health, like a psychologist or counselling. You'll go see a dentist somewhere else. Optometry, you'll go off somewhere as well with another referral. So with the IUE model, we provide all those services in-house, so the patient doesn't have to navigate an exceedingly complex health system with multiple contact points. They come in, they see our GPs, they deal with the allied health workers and the nurses, they get their referrals, but that's all then, those workers are then in-house as well. So they're not actually having to go off somewhere else. They get the referral and generally they'll come back to the same clinic to see the other wraparound services. And we have dental as well, obviously, care coordination. We have a legal team internally that deals with the social determinants and those sort of legal areas. And as I said, integration across the life course. So we have our mums and bubs, which is our program for expectant mothers. And so they're engaging at that point when bub's born. And then we go right through out to aged care. So we have aged care facilities on the south side that that our clients can access and move into. And we also have home-based aged care support as well. And so that's internally, but at a community level, we also work around putting campaigns around preventative health, and a big part of our work is around social marketing. So we're trying to engage community, empower behaviour change. So this is a rundown of the network as it stands now. So there are 4 member services plus Morton Aches and their own clinics. So all up, we have about 21 clinics. We've just gotten funding, a large bucket of funding to roll out a new, I guess you could call it, super clinic up on the north side, which will have, I guess, a much increased capacity. So I'll be looking at, I guess, 3 or 4 times the number of clinicians that we usually have in one of our standard clinics situated at Dacabin. So we've got the funding for the capital works there, so that'll be initiated sometime this year, early next year. And there's a few other facilities going up and expansions of some of our clinics out on the west in the Cambu catchment, as well as a smattering in some of the other orgs as well. So it's a big growth area. And in terms of our marketing, you might recognize some of these brandings. So Deadly Choices is an IUE brand. So that's our main brand that we push our prevention strategies through. So we go into schools, we have all the tobacco cessation marketing, and then also the Deadly Choices linkages with a lot of the teams. So you might recognize a few of those guys. We've got some of the Brisbane Lions we're engaged with a few of the other AFL teams down south, the Hawks and Essendon, and quite a few of the NRL teams as well. So Petro and Preston are IUE ambassadors, so they work for us, and Steve has done a lot of work with us as well. He's on staff and they're great, and figureheads, I guess, to take the Deadly Choices message out through the population. And so a lot of our data that my team deals with on a daily basis comes from the electronic medical records that basically form the backbone of our model and what we do. So we're a bit different to your normal mainstream clinic in that patients or clients, can move between not just clinics within one organization, they could move from say Morton 86, attending a clinic up there. They might move where they live and start attending YBB, or they might go to the coast and attend Cowan. So, you know, contact can come around, can move around the network, and also as opposed to your standard GP clinic and their patient record system they have, it's not just GPs seeing this. You might have 5 to 10 different types of clinicians and providers having contact with the client at various points throughout their healthcare journey. And so we really need a system that can encompass that model. And so we went early on with MMEX, which stands for Medical Message Exchange. So that's an EMR produced by ISO Healthcare based in WA. And it was originally built as a secure messaging service back in the early days, but very quickly moved into a kind of electronic medical record space. And it's now a fully fledged clinical EMR. It's gone through a lot of development over the years, of which IU has played a pretty decent role in sort of helping develop it in the right way. So it's a cloud-based system, which is really useful, and a lot of the other EMRs are moving to that model now as well. But it's very useful for us because basically, as a patient moves between clinics or organizations in particular, their permission to access that record can be shared. So all the organizations, I should say, run off MMEX. We had a situation at some point where 1 or 2 of them were working off best practice or medical director, but everyone's moved to MMEX now. So basically, wherever a patient goes in the network, their record can follow them. So when they go, the GP can, or the clinic can request access, and then the GP can see all their previous consultation notes, medications, full medical history, and it really improves the continuity of care that the patient receives. The other positive about MMEX is that it has a lot of specialty modules. So whether you're talking dental, antenatal, so the mums and bubs, optometry, social works, social health, so your psychologist or counsellor. There's add-on modules that have been built into MMEX that support those particular care types, and so yeah, it kind of encompasses and it really supports. It's the backbone, I think, of the model of care that we provide through the network. The other good thing about this is that we have full backend data access through what ISO call Insights, which is just Tableau server. So it's it's their own licensed version of Tableau that they license out to clients. So we can access pretty much the entire patient record through a reporting database. And so that's sort of where we get our data from. And so my team provides support across the network in a number of areas. So we do all the training for MMEX and help their support, and also advise and help ISA in development and guiding that development. Another big area of the team, obviously, is business intelligence and reporting, which is what the backend data is used for. We support the regional CQI program, and then our research. We have a fair bit of research going on within the institute as well. So we're really supporting data use at both the primary level, so the intended use of the data, which is basically providing care for the patient, and also all the secondary uses of data that come out of that. And secondary uses, it's a number. So I talked about funders before. So we get money from a lot of different sources. So a lot of it's government, federal and state, but there's other philanthropic funders as well that we might get funding from, or Fred Hollows, those type of organizations. All that funding, all those contracts have attached reporting that we need to fulfill, and so we utilize data to sort of satisfy that reporting. We also use reporting, a lot of internal reporting as well. So users anywhere from clinicians to practice managers unit or program managers, senior management teams, all the way up to our boards and CEOs, all have access to our data and use it pretty regularly in terms of decision making and planning. I mentioned planning. Data's been critical in the rollout of the clinics. So we started in 2009, I think, with about 4 clinics. So each organisation had 1, maybe 2 clinics. And so pretty early on, IUI's role was to sort of take the healthcare to the people, because where the clinics were built was where people were living back in the 70s. And obviously, as you know, expansion of cities and house prices and population growth, a lot of people moved out into the suburbs and weren't actually able to come back and get to those clinics. And so we use data to figure out, firstly, where people were living, and where people weren't utilising the services that currently existed. And so that sort of usage of data guided the rollout of the clinics, which went pretty feverishly over the 10 years to build up from the 3 or 4 up to the 21 we have today. But that was all evidence-based and planning exactly where those clinics go to get the biggest bang for your buck. And as I said, data is used a lot. Research, not just quantitative, we have a lot of qualitative data as well, which is pretty important in research. And yeah, data supporting the CQI programs as well. And I guess all this data allows us to understand our clients, so who they are. So we might be looking at sort of the demographic makeup, population mapping, like I said, where people are living versus where they're actually accessing. And we still do that today to figure out where to put new services. So if people are kind of flowing through to other clinics, you know, further away from where they live, that influences where we sort of focus and concentrate growing services. And then we use census data a lot to overlay sort of general population growth and the parts of Southeast Queensland that are growing the most, and if there's any areas that we're becoming starting to see that are underserved in terms of the capacity we have to deliver healthcare there. We also look at why they're coming, obviously, so their health needs. That could also include social determinants of health, and how they're accessing, so how often they're coming, who are they seeing when they come, what services they're receiving. And this also helps us to identify barriers and enablers to certain groups of patients. So there might be a particularly vulnerable group or that's not accessing, and we couple that with client feedback in particular to try to sort that out and figure out how we can improve access for those groups. So back to our reporting. So as I mentioned, most of our data comes from Insights. So that's a Tableau server solution that ISA provide. And so within that, I guess the backend data comes through from around 140 data sources, separate tables that pretty much whatever you see at the front end of the patient record, it all flows through to various tables, and so we can access those. And we're using about 50% of those routinely. There's some that are, because MMEX is a national program and it's rolled out particularly in remote areas, particularly up in the Kimberley and things like that, there's very different models of care up there and how patients access the service. So there's some parts that are very specific for those sort of situations that we don't really utilize. But generally speaking, we're using about 50% of the data sources. You know, Insights was good for a long time and it served us well, but it just became, as we sort of, our users became more familiar with data and wanted more out of it, we found that it became quite restrictive. Obviously less so recently. Obviously Tableau server functionality is improving quite a bit compared to even when I started with the organization in 2018. But it's still, in terms of dashboard design and being able to manipulate data, linking data across some of those tables. So, you know, we're being asked to provide feedback, for example, of, you know, how many patients have had a health check in the last 12 months that have also been on this medication that have diabetes. So you're looking at like in 5 or 6 tables in the background there, and just with the standard blending that you do through server, it just became really difficult. A bigger issue though was permissions. So we've got 5 organizations and we can see all the data, but there was no real way to provide individual orgs access to their own data without being able to see other organizations' data as well. And it's sort of a function of how ISA had set it up in the background, but still it was a real limiting factor for us. And then, yeah, just the lack of control of data structures and standardizing those tables that we work off and those data sources that we worked off was just made working with the data quite tedious. And then, as I said, more complex requests were coming through, particularly starting to want to link some of our non-MMEX data. So particularly things around finance and HR, that sort of data related to clinics and linking it to patient information. So I guess in a similar vein to our previous presenter, and we just weren't able to do that with the setup as it was. And so the result is a solution that we've termed data lines. And so pretty much it's pretty standard. It's a bespoke data warehouse that was running already. We had a warehouse running to support some of our aged care reporting that we've got some large contracts with on the north side. So that was already pulling data in from a couple of different solutions used in our aged care team, not just MMEX. And so basically we expanded that. It was totally revamped and expanded to incorporate data across the network, not just the aged care space. We currently keep it on premises, but we'll be looking to probably move up onto the cloud in the next 12 to 18 months. So we take the main around 50 data sources that we utilize, and we have daily or weekly data feeds from insights to the warehouse, and along with extracts from the other IUE systems I was mentioning. So the aged care solutions, but also our HR systems, our finance systems, and some of our org development as well. So data around workforce and compliance and things like that go in as well, because our users aren't just clinical users in the organization. A really critical part of the process was getting the ETL right. So I guess of all data sources, particularly routinely collected data is one of the messiest, and you've got to take in a lot of different factors. So it's understanding how the system operates and also how the users operate as well. So how they're entering data, the context in which that data is entered in terms of the consultation or not is really important into making sure that you're not just spitting out garbage at the end. It's factoring in, that initial phase took quite a while of getting that right and making sure that all the quirks of the system and how MMEX sort of outputs data at the back end, even down to simple things as users clicking buttons twice accidentally, and what that means in terms of records generated at the back end, or archiving scripts, or removing certain things, and how certain items from the patient record and how that impacts the data was, that took a while. So, but anyway, we got there, but we're still sort of filtering that through. So yeah, that's the warehouse side of things. And then obviously the Tableau aspect, we stuck with Tableau because our BI analysts were familiar with that, and we were across all the solutions. It seemed to be the one that suited us the best. And so we use that now for mostly visualization. So, but also the still reporting that we need to do, which is probably not the best use of Tableau, but it suits us with the volumes of those reports that we need to generate. And also raw data access as well. There are users that still need data in the raw format, and so we provide it through that. governance around around data lines has been semi-complex, to say the least. You've got multi-layered permissions, so we're really needing to filter by an organization, so that we need to make sure that when someone logs on, if it's a GP or a practice manager down at one of the members' clinics, that they can only see their clinic, but if the senior medical officer from that organization can see data for the entire organization, but no other organizations, and then the CEOs at each organization can see everything, for example. So we're really doing, so we've got permissions and filtering at a number of levels that we use to make sure that, people are only seeing the data that they're meant to see, because particularly privacy around patient health records is quite important. And in terms of governance around data sharing, so we have kind of one-on-one agreements with each of our members, which allow data to be shared. And then we also have a regional agreements as well that all the member orgs sign, and it states what can be shared at a regional level that everyone can see. So it took a while to get that right and to take the concerns in of all the organizations, but we eventually got there, and it's really good that it then kind of lays the foundations for a true regional sort of visualization solution that everyone can access and utilize. So we've been running and developing for about 2 years now. So we've got 2 BI analysts. One of them, Marta, is online today. She's listening in. And we're about to, just in the process of hiring a 3rd. So they're responsible for maintaining access for about just over 100 users now. It goes up and down as we have staff changes, but it's been a steady growth as sort of contents of the warehouse of the data lines has increased. So there's around 170 workbooks that generally have been generated so far, with 140 published. So there's still quite a few in development. Yep, and this is a combination of dashboards and reports as well, mostly visualizations, and they cover a whole range of areas. So for clinics, we're looking at activity and performance across a number of indicators, including health indicators, but also financial as well. And I guess activity, so numbers of health checks that are being done, for example, number of chronic disease management plans that are being written, NKPIs, which are the National Key Performance Indicators. They're a set of indicators that we're required to submit to government or data to government for twice a year. And so, but we also use them internally as a suite of I guess indicators that we can compare ourselves against at a national level against other organizations around the country. And there's a whole suite of dashboards that are specific to certain programs, whether it's social health or optometry or pediatrics or the pharmacy team, dental. They all have sort of different needs. And we're in the process now of, there was an initial rush of producing content. We're starting to sort of identify common areas and reduce the number of, I guess, optimize the number of dashboards we have. So where there's information that's common across teams that they all need the same sort of stuff, then we're looking to sort of reduce, I guess, the number of dashboards and make it easy for them to find what they need. And there's dashboards, obviously COVID, it was really useful having a set of visualizations that kind of gave us a daily update of how many tests we were running, number of positives coming through, what sort of treatment they were receiving. And that was all used to feed back to government as well. And then, as I mentioned, the back office. So we have a lot of finance, HR dashboards, and around org development and workforce management as well. So, and it's good to see that as people get more familiar with it, we're seeing a steady integration. of that data to be used on a daily basis. And as I mentioned, it's being used by practice managers daily to see how clinics are going, all the way up to our boards, and it's being looked at. They have their own set of dashboards that they look at their quarterly meetings to see how the network's going as a whole. So some of the challenges, as I mentioned, routinely collected health data is the main one, and it's, as I said, it's messy, and it's yeah, and you've got to understand exactly why and how the data has been collected and for what purpose in the context of the contact between the provider and the client. The quality of the collections, so CQI, that's a big part of that, is improving clinicians' capture and just, you know, a clinician when they're working, data quality isn't probably first and foremost on their mind. So it's really driving home the link between sort of data in and data out, and the quality data actually does impact and improve the care that a patient can receive. And as I mentioned, the system quirks and how the system works at the back end can impact the data that we're seeing coming out as well. So the network structure is another challenge. We're always adapting. So there's going to be a big growth soon in terms of the number of clinics and the nature of some of our orgs, and we've got to adapt to that as well, because that will flow through into not just the data, but also how it's governed as well. Data extraction is a real pain in the butt for us at the moment, because unfortunately ISA don't have any direct connection or APIs into their reporting system. It is coming. We've been waiting about 2 years, and hopefully next year we're going to have direct API access into the reporting database, so we'll be able to plug our warehouse straight into that. Or we could go in directly with Tableau, but we've got sort of other reasons why we want the data to come into our warehouse first. So that'll be very nice, because at the moment our team has to manually download 50 extracts from the system not each day, but nearly each day. So it can be a bit of a pain. Data literacy, obviously, so getting people, it's always the thing, right? When you create a dashboard you think is pretty simple, there's always going to be plenty of people looking at it going, what the hell is this? So it's trying to you know, get that balance between information and readability and the ability for people to interpret and use that data, and also helping them at the same time to improve data literacy as well. System updates is a big deal. Every time MMEX changes, they might change how the front end looks. That then flows into what the data source looks like at the back end. And there's been quite a few times where we've come in on a Thursday morning after an update's gone through, and 15 of our reports are broken because the fields have all changed. So that's a constant thing we've got to work around as well. You know, but despite all those challenges, all in all, it's been having our own Tableau internally in the warehouse has greatly improved how we can access our data and what we can do with it. And in terms of some of the questions we can answer for management around what's happening in the clinics and what's happening for certain patients and how access is actually occurring. So for future improvements, as I said, API next year will be fantastic. There's still plenty of data that we collect that we want to integrate into the warehouse to just improve access as well. And this will all require a growing team. So if anyone's looking for work, we may be looking for another analyst, but you can contact me later if you are. Yep, so that's me. I'll stop because I've probably gone on for too long. And if there's any questions.
Thanks, Larry. I think that was an amazing story. But not too long. I'm sure you could have spoken for more. And I'm sure some people might be keen to maybe talk to you about jobs, maybe in the room. Some people shaking their heads. Is there any questions online in the virtual? the room? Any in the audience?
Yeah. Hey guys, how you doing? Sorry, my cat's attacking my arm, so I'm getting a little distracted. Great presentation. Thank you very much. I really enjoyed that. I've personally been looking into a lot of medical data and conceptualizing a few different concepts and ideas. I guess one question I had for you is, with that amount of data that you've got and some of the challenges you've got around the data, I know you touched on data quality. Yeah, I'm wondering from a governance perspective, how you guys are managing your metadata, and what's your process to, if any, at this stage, to empower your users to leverage that in order to make better use of the data and generate more insights from it, and actually want to use the data more.
Yeah. No, that's a good point. So, I mean, I guess we don't get to the level of metadata with users. It's as simple as getting, for example, a clinician when they're in a consultation. MMEX is quite, it gives you a lot of functionality. So around the consultation note that you might type in, which is free text, and we don't actually access that due to a number of reasons, but primarily privacy.
Yeah.
But there's a lot of, in the system, there's a lot of structured fields that are linked to that progress note that you can, or that consultation note, that can give you a lot of insight into what it's about, what program it's linked to, what was dealt with in the consultation, those sort of things that generally, you know, if you come from and I get it, you come from a GP's point of view, they've got 30 minutes to get through, you know, stuff that should take an hour to get through properly. And so they might not use those, and often they won't use some of those, or they'll click the default value or something like that. So it's really about at every level and across most practitioner classes. There's some worse than others, but it's about empowering them in terms of just showing them how to use it properly, and then showing them at the back end what we can do and the kind of information we can provide back to them. So that's the biggest thing, because they'll come to us and say, we need to report on this, this, and this. And they'll say, well, that's great, but you've thrown it all in free text that we can't access, or you just haven't reported it at all. So if you record it like this, we can do this. And that's just, it's a continuous process, and some programs have been really receptive, and we've seen massive improvements in what they can report against, and also the sort of insights that they can gain to the impact that the services they're delivering has on the clients. So yeah, it's really around that usability, and CQI plays a big part of that as well. And we've got, you know, yeah, it's just it's a constant focus. You know, it's just that balance between time poor clinicians and getting the user system properly.
Yeah, always a bit of a challenge trying to get people to follow best practices in order for them to enable them to get the most out of the tool itself. And it's one thing to sit there and go, okay, I'm going to write lines and lines and lines of Python code to pull data out of the free text and regex expressions and whatever, but you don't want to do that. You just want them to just use the tool better so that they can get the most from it. So yeah, it's definitely a challenge. Anyway, thanks very much. I appreciate that insight.
Yeah, no problems.
Thank John for the question. Any other questions?
Hey Lyle, hi, it's Garrett here. I'll just ask a really quick question. Hopefully you can hear me okay.
Yep.
You know, just around patient outcomes, right? I mean, you've done a whole heap of work here. It's an amazing story, amazing journey you guys have been on for a number of years, right? And I was just wondering, you know, have you noticed any sort of outcomes on the sort of the patient health, patient well-being? You know, that's kind of at the back of all this amazing work you've been doing with data.
Yes, so I mean, there's various ways we measure that. We did some work with epidemiologists a few years back on looking at health adjusted life expectancy, and we did some decent modeling around that in terms of how our patients were comparing to the general Aboriginal and Torres Strait Islander population, and seeing how it mapped projecting forward. And the modeling seemed to indicate that there was a decent impact in that the gap, you hear a lot about closing the gap. So for a few in the health adjusted life expectancy, the gap was closing faster for our clients than the general Aboriginal population. Obviously, there's a whole lot of assumptions built into those type of models, and they are just projections. It's quite difficult, isn't it? Because if you're looking at, for example, you can look at some short-term things. So are patients with diabetes managing that better? And you can look at the HbA1cs and things like that and track them over time at a patient level or an aggregate level, whatever. But if you're sort of saying, well, as a child that's gone through our early childhood programs, are they going to finish school, or are we have an impact on the number of kids that are finishing school, or are our social health programs supporting families early on? Is that going to, are we going to see kids finishing school, or are they going to, is it going to increase the life expectancy? They're all really long-term outcomes, so they're a lot harder to measure. So outcomes in the health space is always a bit difficult. We do have, all our clients get what's called a Aboriginal health check each year. And so that's basically an intensive sort of hour check-in with the GP and the nurses. And we have a sort of pro forma template in MMEX that goes through all areas. So not just physical health, but all the social determinants as well. But our first question on there is very simple. We just wanted a snapshot of how people are going. So it's a simple question of how deadly are you feeling today? And the benefit of that is that we get that. It's only one question, and it's only like a self-rated health score, but it's collected for everyone and it's collected yearly. So, we can use that as a indicator of a rough indicator of how people are feeling overall. But then you'll look at subgroups, particularly around social health. They'll be doing kind of validated psychometric, going against scales and things like that. And so all that's recorded, and we can sort of track, that over time for those groups of patients. So there's a lot of ways to measure outcomes. But that's probably of all is the hardest to measure, I think. It's easy to look at activity and who's coming to our clinics, but the outcomes that's the tough one.
Yeah, thanks for sharing. I think we all have that trouble, right? Regardless of whether it's healthcare or business setting or wherever we are, right? It's measuring the longitudinal sort of outcomes, but the important stuff. So to see how it runs, and glad to see the work. Thanks for sharing.
Yeah, almost a bit like how do you kind of use the insights that you're creating in order to be able to give some assurances, I guess, back to them as individuals, as human beings, and saying, without this or without us, compared to how you were, this is how you're going, and being able to kind of give back a bit to that community as well via the data, which might help them to feel better in the day-to-day lives as well, depending on what each of their situations are like. I'm all about people. Humans, we're not commodities, we're individuals, and it's nice to be a part of a conversation that is about healthcare and giving things back in a way. Love to see that kind of expand out even more and influence and inform the communities at the same time through the tools you've got.
Yep. Yeah, no, definitely.
You should be presenting your story at the Tableau conference live. We should put the words up there, because it's an amazing story to share. Any more questions? Oh, looks like we need to wrap up. An amazing discussion, guys. Lyle, again, thank you. You're sick.
No problem. I just realized I didn't turn my camera back on. Sorry about that. You've been talking to a black screen, but yep.
And for people listening in the room or virtually, if you're looking for jobs, I can donate you, email you, just ping me and I can forward Lyle's details. Dave, thanks as well. Thanks, Manny. That was amazing. And as I said before, if you the next Tableau user group, we meet every couple of months. Just ping me online, and then it doesn't need to be a half an hour. Can share a couple of tips as well. So don't be shy. And if you're looking for jobs, don't be shy as well and ask around. we might have some hiring managers in the room that are looking for. Maybe Gary, you can be on. I don't know.
You never know.
You know, so just come along virtually in person. Thanks again. Talk to you soon, guys. See
Thank
soon.
you. Bye.
Thanks again. And now, drinks, eh?